Well, the decisions about ESA dosing obviously are predicated in large part on where you want to stabilize the hemoglobin level. Typically we target 10 to 11, but often we make multiple adjustments throughout the clinical course of the patient without fully realizing that many of the adjustments may not even be necessary. And often people will choose doses of ESAs based on maybe distance from goal. So if your hemoglobin's 8 and you want to have them 10.5, you might give them a larger dose. Or if it's 7.5 and you really want to get them up to it. But again, we found that it really didn't matter. If you gave low dose, consistent, dosing in iron replete patients, it really did not make a difference. No, I think things are remarkably improving from a clinical therapeutic standpoint. I mean, there's so many new opportunities, whether it's using SGLT2 inhibitors in people with diabetic kidney disease, the advent of HIF stimulators or prolyl hydroxylase inhibitors for people with anemia due to chronic kidney disease, the development of new monoclonals, for example, for treating ankylosing. I mean, there are just so many opportunities that are opening up now with the development of newer products and opportunities. I think, this is probably one of the more exciting ASN meetings I've been to in a number of years with regard to, in a sense, the new opportunities. Yeah, I think most of the buzz that I have heard from a clinical translational standpoint probably centers on the use of SGLT2 inhibitors for people with diabetic kidney disease, as well as also for those with heart failure with reduced ejection fraction. I think also, too, the HIF stimulators, prolyl hydroxylase inhibitors, are really making some inroads in terms of their clinical trials and reporting out efficacy and safety. I think there's a lot more conversation now about using, for example, some of the newer potassium binders to facilitate, the use of optimum guideline-based renin-angiotensin system blockade in people with kidney disease and heart failure. There are really many therapeutic areas where, substantial efforts are being made to improve the overall quality of care, especially with newer therapeutic agents, but even newer diagnostic agents.